If you ever had a child, you would have come up against a nappy rash. And for a lot of parents, they often take it as a personal insult on their ability to look after a child. Every child that's ever born has had a rash, because at the end of the day, they are children, they don't have bowel control, and they have excrement coming out of number 1 and number 2 in a concentrated area in a diaper, whether it is a commercial diaper, disposable, or whether it's a toweling, or it is old school cloth nappies. So in the first couple of years, children are susceptible to these rashes. And it's not a personal reflection on your ability to bring up your child. So I'm going to demystify and help you understand what causes nappy rashes and how to deal with them. So if we start off from an early stage, a newborn, and I see this only too often right early in hospital. When a baby's born, they have something called meconium that they pass, and it's that black tarry stuff. So often petroleum jelly is put on the bottom to help remove it because it's easy. But petroleum jelly is not a great product for a baby's bottom. And because what it does do, it blocks up the pores. It stops the skin breathing. It also, because of the thick layer, it acts as a waterproofing system on the nappy. So if you imagine if you've got a bottom and you've got a nappy, and you go and put a big, thick, greasy layer of petroleum jelly, all you're doing is blocking up the pores on the bottom and you're waterproofing the nappy. It's almost as though you're putting a plastic bag on the baby's bum. And how on earth can whatever comes out of that bottom go through this interface and layer of grease and be absorbed in the gel of the nappy? So as you can see, sometimes using nothing is great. You know, disposable nappies today, they're not actually nappies. They're not diapers. They're pieces of technology. They are designed actually not to be used with creams. They are there to absorb everything that comes out of your baby's bottom, to be absorbed into that gel. So try to avoid using creams. We are still, unfortunately, inheriting the past. There are lots of companies that still want to promote and use all these bum creams and all these products. And you know, I have a lot of my parents talk about all these brands they're talking about, all the brands they're using, you know, and they use them, the brands, as though it's some sort of magic potion that they're putting on a baby's bottom. At the end of the day, you know, less is more. There can be just a very slight film that can be put on. Breastfed babies have more nappies. They pass more poos. So they're more likely, unfortunately, to have their bottoms cleaned. So if you think about it, we want to do the best for our children. And I see often right early on, right around the back passage, because of parents sort of OCD cleaning the nappy area, it is actually a little abrasion, like a little roasty, by using lots of wet wipes. So around the back passage, put a bit of cream. That's a common area where there's a bit of a rash. And cleaning the nappy as often as possible. So there are two different types of nappy rashes. There's something called a chemical irritation, and that comes from urine that comes out of the baby, the excrement, and if it stays in contact with the skin, it causes an irritation. And particularly in warm, humid environments, that uric acid gets converted and cleaved and by bacteria in the environment, particularly the warmer it is, the quicker it happens, and it forms ammonia, which is basically bleach, and it causes an irritation. It's just a red irritation. Then, of course, what most parents think about is thrush. Now, thrush is a fungus, and children under the age of 6 months are most susceptible because the immune systems can't fight fungi like they can other things. So these infections start off like little spots. They call them satellite lesions. Like you look up into the sky at night, all the stars. It starts off like individual spots. And then they become more plentiful. They coalesce and form patches. That often needs an antifungal cream. If you expose it to air, it disappears. Thrush happens in moist, kind of covered areas. The mouth, under their armpits, under the chins in children, of course, the nappy area. So exposing it to air often helps. There are lots of antifungal creams. Those can be used when necessary. Now, use of toweling nappies in the past, that's when you needed to use a lot more creams. And that's what we're inheriting, because those creams were big barrier creams. You know, most disposable nappies are of good enough quality. There can be reactions, there can be allergies to those nappies, particularly around the fasteners, where they are around the legs, because what happens is there can be an allergy to latex, and that is something I often see. In a newborn baby, just the pressure can cause a redness. So the most important thing with a nappy rash is recognizing, is it a thrush or is it a chemical irritation? Stop using the creams. Use less creams. Change it often. You might find that your child has more of a rash in the morning because the older they get, they often drink at night. You're not going to change the nappy as often, and they are more exposed to urine and stools that are in contact with the bottom for longer periods of time. So that would be a time to use more creams in the evening to protect the bottom area, so that it acts as a barrier overnight. And then, of course, when a child is a lot older, the quicker they get out of nappies, the quicker they have less rashes. So I thought that would help. Often, less is more, less creams, less medication, and knowing what the problem is.